Welcome everyone to our spotlight on pharmacy careers. Before we begin, I just wanted to cover some of the housekeeping. This session today is being recorded and will be available on demand on the Humber North Yorkshire Careers website. To help with the smooth running of the session, we have disabled delegates' videos and microphones. If you do have any questions during the session, please pop them in the chat box and our colleagues will answer them either in the chat or at the end of this session. So I'm Melanie Drayton and I work for Humber and North Yorkshire Health and Care Partnership as the Careers and Employability Programme Support Officer. Humber and North Yorkshire Health and Care Partnership formed in 2022 and comprises of NHS organisations, local councils, health and care providers, voluntary, community and social enterprise organisations. The partnership is one of 42 integrated care systems which cover England to meet health and care needs across an area, coordinate services and plan in a way that improves population health and reduces inequalities between different groups. We work across a geographical area of more than 1,500 square miles and serve a population of 1.7 million people, all with different health and care needs. Our areas include Hull, East Yorkshire, York, North Lincolnshire and North East Lincolnshire. In order for us to meet the health and care needs of the population, we need to ensure that we have appropriately skilled workforce reflected of the communities we serve. Part of my role is to develop our talent pipeline and inspire and grow our future workforce. One of the ways I do this is by delivering spotlight on webinars to showcase the range of careers available in the sector and highlight the variety of routeways in the sector. Thank you, whoever's letting the people into the lobby. So I'm delighted to bring this youth webinar today to shine a spotlight on careers in pharmacy and the variety of routes into the sector. So in today's session, we're going to have an introduction to pharmacy careers and then hear from some of our professionals about their career and pathway into the role. Over to Dominic Burns and Daniel Hobson.
Hello, so my name's Daniel Hobson and this is Dominic Burns, and we're both pre-registration pharmacy technicians and we're doing our technician pre-reg in technical services, which are sort of specialised areas of pharmacy that deliver specialised services that you wouldn't always see. So aseptic services and clinical trials are sort of what we'll talk about in the later slides. So, and then we'll talk about how we got into our careers into pharmacy as well. So next slide, please. So this is just quite a quick timeline of my journey into pharmacy. So in 2016, I completed my GCSEs and I did quite well, and I sort of always enjoyed school. And once I finished my GCSEs, I went to complete my A-levels at sixth form. And again, I did quite well in my A-levels as well, but sort of at the time of leaving and never like applying for universities, I didn't really feel like this was for me. So I didn't apply to a university and sort of took a bit of time out after sixth form to sort of work out what I wanted to do. And then sort of 2019, after working part-time for a bit at different jobs and stuff, I did a bit of job searching and came across NHS Jobs, the website, and came across a pharmacy assistant job, which was like a 2-year fixed term. And involved in that was an NVQ level 2 in just basic pharmacy services, which you could complete as well. So it looked appealing. So I applied for that and got that. And I started, I started at the beginning of 2020, got put through my level 2 NVQ in pharmacy services. And following that, became a senior pharmacy assistant. I did that for a couple of years. And that was mainly based in aseptics. And then in 2023, I applied and was successfully enrolled into a pre-reg pharmacy technician apprenticeship. But it was the first one of its kind because it was focusing on technical services. So not the usual sort of pathway where you do the general pharmacy. It was more focused on technical services, so aseptics and clinical trials, and it was gaining all the requirements and criteria through them areas. So, and that's where I currently am at the moment. and it's going really well.
Breaking up there.
Next slide, please.
So yeah, this is my timeline of how I got here, and it's a bit longer because I'm a little bit older, but as you can kind of see, it's kind of a bit wishy-washy. So I left school in 2003. I didn't really have any idea either what I wanted to do, so I just kind of gave quite a lot of different things a go, from like part-time jobs, restaurants and all sort of stuff, to acting, martial arts teacher, and all sorts of very different jobs. Kept on doing that quite a long time, and eventually when COVID rolled around, I was made redundant because of the state of things. And that's when I started firing on my CV left, right and centre, just trying to get another job in things that I was used to. But I saw obviously what was going on with the NHS at that time and decided to give it a go, as you know, it's something I was interested in doing, and wanted to kind of try and help make a difference during COVID. It's something I never really considered, never thought I'd be able to do. But yeah, landed a job in the pharmacy stores, which involved just delivering drugs around the hospital. And it's sort of never looked back since then, really, just been progressing ever since. Completed my level 2 as well, and then applied for different jobs within pharmacy. So I went from stores to clinical trials to main dispensary, and the same kind of thing, followed in Dan's footsteps and did the pre-reg course, and just partway through my first year now, and again enjoying it, and yeah, just getting to explore all the different areas of aseptics, clinical trials, and the chemotherapy stuff that we deal with, and getting to grips with all that. So yeah, it's been very good.
Next slide, please. So I'll just talk a little bit about the day in the life of aseptics. So to anyone who doesn't know, aseptic services is like a specialized area of pharmacy that sort of main duty is to like supply specialized medications that you wouldn't often be dispensed in like a general pharmacy, and it's usually for like the complex needs of like certain patients. So a lot of the patients are cancer patients, and because of that, a lot of the medications we produce and dispense chemotherapy. So some of the stuff we do is preparing the chemotherapy and like other high risk medications in the aseptic isolators, which are big units all inside a clean room, which is based in the hospital, which is just a big room that's controlled by an air handling unit, and it's got to be as clean as possible just to reduce the risk of any contamination to the products that are being made, because the patients that are receiving these are the most vulnerable. So it's just everything you do is making sure that it's as accurate and as clean as possible when you're doing it. So we do that. We also dispense medications as well. So that's sometimes medications that we can't make inside the unit, or ones that are cheaper to buy in. So we'll do that as well. So we'll purchase in medications and dispense them for different clinics and different patients. Involved with the unit, we've got to do a lot of maintenance on the unit. So this involves cleaning, environmental monitoring, like swab testing, to make sure that what we're doing is correct. We do a lot of validations to make sure the unit's functioning properly, and what we're doing within it is of a high standard and it's providing a good service to the patients. We also create a lot of new procedures and worksheets for products. Each individual product we make in the unit has to have its own procedure and worksheet. So it's a bit similar to like a practical in a science lesson at school. You have a method that you've got to follow concisely, just to make sure it's very accurate and valid for what you're making. We also receive and process prescriptions for patients. So these come from hematology clinics, oncology clinics, and also inpatient chemotherapy wards. So Ward 31 at our hospital. We get a lot of drug orders from there. And finally, we do ordering and receiving of medications. So within aseptics, we sort of have our own procurement team. So we order in a lot of our own specialized medications and raw materials that we use in preparation and also to dispense as well. So there's quite a nice variety of things in aseptics. So next slide, please.
So yeah, the other side of it is the clinical trials, which is essentially like the research side of stuff. So we are involved very much in kind of dispensing out medications that are either going to be brand new, and someone wants to investigate how safe they are, how effective they are, or someone's come up with the idea that a certain illness can be treated by an existing drug, and we then sort of help do the paperwork behind it and get the things up and running, and then dispense those to see how effective they are against a different kind of treatment. And then, yeah, these are all sort of prepared through sort of universities and sometimes commercial sponsors like actual drug manufacturers. They want to investigate all these products, so we're involved in that. It involves sort of setting up some of the areas that we're actually going to be using. So last year we had a study where we had to keep going backwards and forwards to a certain area in the hospital and making sure it was actually going to be prepared to receive these medications, store them correctly, and administer them correctly as well. And just making sure that safety is at the forefront of everything that we do. And obviously as well, confidentiality and stuff like that, because there's certain trials that people are receiving drugs, but they're not actually being told exactly what it is in case it's sort of like it has a biased result. So we're kind of working on that ethos. We support all the research teams and research nurses in what they do day to day. And yeah, so on the slide there, you can see some of the results. This wasn't one that we were involved in York, but this is the sort of thing that we do. We investigate things that can help cure cancer, for example. So it's yeah, it's a brilliant thing to be involved in. Yeah.
Next slide, please. Yeah. So yeah, we've also just done a slide of sort of what it's like being a student, sort of doing an apprenticeship whilst working. So one of the big positives of it is a fully funded apprenticeship course, which is funded through the NHS. So it's all paid for you, and then obviously you're earning a wage because you're working at the same time. So that's a really good positive. There's a combination of online and face-to-face learning. So me and Dom get one study day a week. So 4 days we're working and then 1 day we're studying. So it gives us a lot of time to learn sort of new things that we need for our job. And it's a nice balance of doing it online and face-to-face. We learn about treatments and preventions for a huge number of different illnesses and conditions, which is good. So you're understanding what the medications are doing that you're dispensing or that you're making up in an aseptic unit. It's a good opportunity to meet new people and network with a variety of professionals in the pharmacy industry. This is done through rotating to different areas of pharmacy and just meeting different students from different trusts that are on the same course. A lot of the learning is also done on the job. Sort of you learn new things most days being a student. And this is good as well because there's a lot of support from co-workers. A lot of the staff at York are technicians already, so they've experienced what me and Dom are going through. So there's always people to provide support and advice. So you feel very well supported when you're completing the course.
Yeah, definitely.
Continually building knowledge and applying it day to day. So like I said before, what you're learning sort of in your study days, you're then applying it whilst you're at work as well. So it feels valuable what you're learning and you can sort of see how to use it day to day. And then we get to experience a wide variety of pharmacy and healthcare settings. So that's like rotating to different areas of the hospital, like different wards, different specialities. Got like renal units, chemotherapy wards, different areas like that you can rotate around and learn new things. And then once you have finished the course and qualified as a technician, there's a variety of different positions. So although me and Dom sort of specialising in technical services, at the moment, there's nothing stopping us from applying for a technician job elsewhere, sort of in the main dispensary or in renal. So it does open a lot of doors once you've qualified as well. So we look forward to that once we've qualified.
Thank you very much indeed. That's very interesting. Okay, so now I'm going to hand over to Mariam, who will be talking about their role in pharmacy.
Hi, I'm Mariam Arawi. I'm a trainee pharmacist in York Hospital. and I'm doing split, so I'm doing 9 months hospital and 3 months in GP. Next slide, please. So I went to secondary school. I went to New School for Girls in Hull, and I did my GCSEs and passed all my exams. And then I went to college, White College, and I did A-levels, chemistry, biology, and psychology, and I got AAB. As part of I've always wanted to do pharmacy, so I knew what to do in order to apply for university. So I volunteered at a charity shop and I did placements. So I did 2 weeks in a community pharmacy and 3 weeks in a dental clinic. So I could, talk about it in my when I submit my form to the university. So I applied for Manchester University and I got in. I did the Masters of Pharmacy, and it's a 4-year course. So I'm from the old batch, so I graduated without the IP course, which is the independent prescribing. However, right now the new course, the updated one, you would graduate with the independent prescribing course. I also did the Stellify Award, which is like all to do with volunteering as part of the Manchester University Stellify Award, where you volunteer and you get the award at the end of the 4 years. I was also a PALS leader, so you would help students that's a year below you in terms of calculations, in terms of studying. They would come to you and you would help them that way. Next slide, please. So I graduated in July last year, 2023, but before that I had to sit an oral exam at the start of 4th year of my MPharm course, and the oral, it's situational judgment test and calcs exam, and that will determine what placement that you do, because as part of Masters of Pharmacy degree, you would do 4 years and then you would graduate, and then you have to do a foundation training year, which is the year I'm doing right now. So to get allocated a place, you have to go through oral, which is the test I sat at the start of 4th year. And according to what you get, that's where you get allocated. So I've always wanted to do hospital and GP, so which is why it was like in the top, my top ranks, and that's what I got. So I'm doing 12 months in total, 9 months in York and Scarborough Hospital. So sometimes I go to Scarborough Hospital, but I'm mainly located in York. And I also just finished 3 months GP, so I did it from end of January mid-January until mid-April. So during GP, I sat and reviewed medications with the pharmacist, and we would ring patients. We would have 5 to 10 minutes for each patient. You would call them, see how they're getting on with the medications, any side effects, any problems, if there's any interaction between the medications. We'll see how they're getting on, any blood tests that we need to look at. And that was during the GP. When I did my GP placement in York Hospital, I shadowed a pharmacist. I work with pharmacists all the time. We go up to the wards, we go to the dispensary. Yeah, next slide, please, if you don't mind. So the rotations included in hospital as follows on the PowerPoint: the cardiology, diabetes, with the antimicrobial team. Currently, I'm doing my dispensary because I was supposed to do it in January, but because I had to go to GP, so it got delayed a bit. So I'm doing the dispensary rotation right now. But usually, when you go up to the wards, specific wards, you'll go with the specialist pharmacist, let's say in cardiology, and then you would review the medications and talk about the side effects of the medication, which also helps with the exam that's coming up in June. And I would carry out pharmacist reviews, and then the pharmacist would look at my reviews and obviously tell me what I did wrong or what I should have looked at, any interaction between medication and the patient is taken. So as part of my foundation training year, at the end of the year, which is on the 25th of June, I've got an exam, which is the GPHC exam. So we would sit that exam, and then if we pass, then we'll be qualified pharmacist. If not, we've got 3 tries to do it. Hopefully I'll pass first time. And yeah, that's what we do. As simple as, well, it's not really simple, it's very hard, but yeah, we just shadow pharmacists. And yeah.
Thank you very much, Mariam. Good luck in your exams.
Thank you.
Okay, so now we're going to hand it over to Chloe, who will talk about their role in pharmacy.
Hiya, I'm Chloe. I am an advanced oncology pharmacist. I work in York. So yes, my journey is a little bit longer. I did my GCSEs in 2005, and then moved to sixth form college to do my A-levels, where I chose maths, biology, chemistry and history. And I must admit, at this point, I had absolutely no idea what a pharmacist did. And however, I was lucky that I did chemistry at that point. Chemistry, though, I have since come to learn is essential to get onto the pharmacy course. So that's something to bear in mind if you do want to choose pharmacy as a career. I completed 2 years of A-levels, and then I didn't really know what I wanted to do when I went to uni. So I thought, oh, I'll have a bit of a gap year where I would do some work. And I got my results, and I wasn't quite happy with them. So I did get a part-time job, but I also, in that gap year, retook a few exams so that I could get my grades up a little bit. And then I actually decided that I was going to do biochemistry. And I went to Leeds University to do that, but very quickly realised that that really wasn't for me. And at this point, it was my friend that suggested to me, why don't you look at pharmacy? And this is because I had since being at school, worked as a waitress and in a supermarket, and I loved customer service kind of roles and interacting with people. And I was always good at science and maths at school, and the two kind of went together. And it had never really occurred to me before that, that actually this would be something that would suit me. So I looked into it and actually thought, yeah, that it does sound like me. So I had a conversation with my tutors at uni and decided to switch from away from biochemistry and applied for pharmacy instead. And I went to Bradford to study. And Bradford had two options. They had the 4-year continuous option to do complete the MPharm, or there was a sandwich course option which involved having 2 6-month pre-registration placements built into the course. And the advantage of that was that you could do 6 months in a different sector. So I actually completed both of my 6 months in community pharmacy, but you could choose to do 6 months in hospital, or now you might be able to choose GP, but that wasn't something that was around when I was a student. While I was at university, I applied for summer placements, again in community pharmacy. So I worked for Boots for one summer, and that was actually really, really good for me, because I am very much of a learn as you work kind of person. So some of the things we were learning at university, I found it very helpful to be able to put that into practice in the summer placements, and it made things make a little bit more sense. I also got a part-time job in my second year at uni, working in a supermarket pharmacy, which again helped me a lot. I learned from the pharmacists that I was working alongside quite a lot by working in that role. I passed my pre-registration exam in 2014 and registered with the GPHC at that point. And my first year qualified, I actually worked in community pharmacy, because I thought that that was where I wanted to be. But actually, once I'd done a little bit more research and heard more stories from other pharmacists, I thought that working in hospital might actually be more suited to what I wanted in the long run. And there was also the option of doing a postgraduate qualification, so that you could learn more of the clinical pharmacy skills. And so after a year, I moved into a role in hospital at County Durham and Darlington. So I was mainly based in Darlington, but you worked across across the trust as a junior rotational pharmacist, and you had the opportunity as a junior to complete a postgrad diploma in clinical pharmacy at that point, which is 2 years, and that could be topped up if you wanted to an MSc master's qualification as well. As a junior rotational pharmacist, I also did some locum work on the side, because although I knew my long-term goal wasn't to work as a community pharmacist, I did enjoy the work, and I did miss it. So I liked keeping in touch with the community side of things, and I did some locum work on evenings and weekends, and it also topped up my wages a little bit, which was a bonus. I spent 2 years as a junior, and then I specialised at that point, and moved up a grade, and I moved into medicine and cancer services and aseptics, and as you've already heard about aseptics, it's a bit more specialised, a more specialised area where we deal with the manufacture of chemotherapy and other drugs. When I worked on the wards in medicine, ward work can be very variable. It can vary from a very busy day where you've got a high turnover of patients. You would do drug histories and what we call medicines reconciliation, make sure patients are prescribed medicine safely. We do regular reviews to make sure that anything new that's added is also safe. If there's any changes in, say, a person's condition or their blood results, is there anything that we need to do to advise any changes to medications, that kind of thing. In the aseptics environment, where I worked specifically in Darlington, everything was all based in aseptics. So cancer services was run from aseptics, which is different in different hospitals. Some areas, the clinical side of things is run separately to the aseptics team, but we did everything all in one go. So it was, you had to learn to multitask, which I did kind of enjoy. It kind of linked back to my community days, and how I was trained. So I did enjoy that kind of environment, but I also missed the patients because it was very much away from a patient-facing role. So at that point, I decided that I did want to concentrate on moving to a more clinical role within oncology, because I had found that that's where my biggest interest was, having rotated around different specialities within medicine mainly, but oncology really did interest me the most. So after I'd finished my postgrad diploma, I moved onto the independent prescribing, and I chose an oncologist as my mentor to help me through that course. And I qualified as an independent prescriber in 2020, sorry. And I also, at that point, was promoted again to the senior pharmacist within the cancer services team. And as a senior pharmacist, I was offered an opportunity to start running my own clinics, reviewing patients who are on active cancer treatments. So when I was in County Durham and Darlington, I reviewed patients with lung cancer or breast cancer, and I'll tell you a bit more about how that works a bit later. And then late last year, I took another move to an advanced oncology pharmacist role, which took me out of aseptics. So as a senior pharmacist, I was still kind of half and half. I had clinics and I was patient facing, but I was also still in the aseptic environment at that point. But now I've moved entirely away from the aseptics side of things, and I'm in a more clinical role as an advanced oncology pharmacist. And the pathway I am on should hopefully help me through to consultant pharmacist level, but I'm very much at the beginning of that pathway at the minute. Can I have the next slide, please? So this is a week in the life of Chloe. On a Monday, I'm at the urology clinic at the minute, reviewing patients mainly with prostate cancer, but some patients with bladder and renal cancer too. I work alongside consultants specialising in the same area, who will refer patients into my clinic for review of their active treatments. So if they're on hormonal treatments or chemotherapy or targeted therapy, as we call them, specific drugs that will target specific mutations in cancer. It sounds a bit complicated, but it's all just different types of drugs that we use to treat cancer. But what I mainly do is manage the side effects and the symptoms associated with those treatments and the cancer itself. So I will review the patients and make sure that they're managing okay. If they've got any problems, I can make dose changes, or I can add in supportive medications as a prescriber, and help them through their journey while they're receiving treatment from us. On an afternoon, I would catch up on admin work and do what we call professional practice. So reviewing and updating protocols, because we love a protocol in pharmacy, and make sure that everything's up to date, writing new guidelines, line management duties as a senior member of the team. I would line manage more junior staff, and I act as a mentor as well to junior members of the team, helping them progress their careers too. On a Tuesday, I have a lung cancer clinic, doing very much the same kind of reviews as with the urology clinic, and again, professional practice on the afternoon, catching up on admin, writing letters to GPs, that kind of thing. Later on in the week, I might do clinical checking of cancer prescriptions. So as mentioned by the aseptics team earlier, they will dispense the cancer medications, but that has to be done against a prescription, and that prescription needs to have what we call a clinical screen first by an appropriately trained pharmacist who is signed off to check cancer prescriptions. And we do, within our team, we do slots checking those prescriptions, as well as answering queries from various members of the team, the nurses and the doctors. If they've got any queries that we as pharmacists can answer, they will come to us at that point too. I would also help out in dispensary and on the ward where I'm needed as well. So dispensary work is covering, helping to check prescriptions for patients who are being discharged from hospital, mainly, to make sure that they're safe and they're getting all of the medications that they need to take home with them. And another part of my job would be to ensure that I am working on my own educational development and research as well. So I'm currently undertaking a master's in oncology as an extra qualification, just to top up my own knowledge and help to keep me up to date with my own continued professional development, which we all as pharmacists have to prove we are doing. I am also currently working towards consultant pharmacist accreditation, and research-wise, I help to complete regular audits and data collection, and I've had poster. Last year, I took a poster to a national conference, and helping out with research that can be published in journals as well. So generally, I've worked with teams in a team to help produce a journal publication. I haven't yet done anything of my own, but hopefully as part of my masters and improving my research skills, I would hope to look at doing more of my own research to publish in future. And we always have various meetings within the wider MDT to participate in. So we work very closely with the doctors and the nursing team within cancer services, and we have very good relationship with them too. And I think that's me.
Thank you, Chloe. That's quite a journey, isn't it? And an inspiring one. So thank you very much for that. So now we're over to Kelly, who's going to talk about role in pharmacy.
Hi everyone. So I am a principal pharmacy technician at York and Scarborough. You've got half of York and Scarborough on today by the looks of it. If you could pop the next slide on for me, please. So I know we skipped a few of the first slides. So just to give you an idea of some of the different roles and specialities and things that you can go into in pharmacy. So you've heard from sort of trainee technicians and pharmacists. We do also have dispensers and support staff and administration staff within our team. So I started out as support staff working in community pharmacy, and you can see there's quite a lot of specialities that you can go into. So dispensary, clinical governance, home care, patient safety. There is literally anything and everything you can think of you can do in pharmacy. There's quite a big range of workplaces. So I have worked in community pharmacy and hospital pharmacy, but we also have GP surgeries, care homes, prisons, armed forces. So basically anywhere that there is people, you can get a job in pharmacy because they will always need medication. Also universities. So if you like teaching, there is people who have qualified as pharmacists or technicians and then moved on to university to teach others about the profession. Next slide, please. So what do pharmacy technicians do? So technicians carry out a huge range of roles. As I said on the last slide, they do some of the same tasks as pharmacists. So we engage with patients, manage the supply of meds, liaise with other members of the healthcare team. Role of technicians is regulated by the General Pharmaceutical Council, and it's developed significantly in recent years. So with the trainees, once they've qualified, they will have to register with the GPHC, and they ensure every year that we are doing that continuing professional development to make sure we're up to date with our skills. Next slide, please. So this is just a bit about me. I didn't know I was going to be on the camera, which is why I put my picture in. So I left school at 16 with my GCSEs, grade A star to C. I didn't really like school, if I'm honest. I was a bit naughty at school. Worked in a hotel whilst I was at school, so I've had a job since I was 14. So I've always known, you know, sort of working life. I think having worked at such a young age and having money, I think when it came to sixth form at 17, I didn't really want to stay and study. I just wanted to earn. So I did my first year, initially thought I wanted to do law, found it really, really boring. So dropped out of sixth form just to work. And I worked in a supermarket for the next few years, not really knowing what I wanted to do. I just wanted the money. But there was an in-store pharmacy at the Sainsbury's where I worked. I'd sort of seen what they did and thought, oh, that looks quite interesting. There wasn't much in what I was doing in my current role. So I thought, well, I'll give it a go and see. And then quite quickly realised that was what I wanted to do. So I applied as a counter assistant. So serving patients for medications, taking in prescriptions, and then was enrolled onto an NVQ level 2. So this is something you can enrol on in any pharmacy setting. All you really need is maths or English for this. So quite quickly did that, and then did a few other courses to become dispensary stock manager, and also had more roles introduced, so like leadership, key holder, things like that. Alongside being a dispenser, I also became a stop smoking practitioner. So I actually ran my own stop smoking clinic out of the community pharmacy. So that was really rewarding. And I think what pushed me to go towards hospital by making that difference to patients. Next slide, please. So I came to hospital pharmacy at Scarborough as a dispenser. In that first year, realised I didn't know anything. I thought I was a really big fish in community. I thought I knew how every drug worked and what every drug was, and came to hospital and my mind was just blown at how many different things there was, how many different roles there were. So one of the roles was medsman assistant. So that was something that had been developed in other trusts, but we didn't have in our trust at that point. So I was sort of the guinea pig. I was the first MMA, which is a ward-based role, assisting with patients' discharges, pod checking. Did that for a year, and then enrolled onto a student technician course, which is what Dan and Dom are doing. So that's a 2-year apprenticeship with Bradford College. Again, entry requirements for that were just English and maths. So if, like me, you're not 100% sure, or your grades are maybe not amazing, you don't have the A levels, it is a different route into pharmacy rather than university. So yeah, 2-year apprenticeship to get my NVQ level 3. Qualified as a technician and registered with the GPHC. I got a job as a rotational tech after that, so that was where I rotated around the different departments in the hospital, so procurement, stores, dispensary, meds man. Then was promoted to dispensary team leader and a meds man technician, so similar to the MMA role, but this involves patient history taking, line management of staff, so a lot more responsibility introduced. So did that for however many years that is there. Took a year out to have my daughter, and then have recently been promoted to a Band 6 Principal Technician for Education and Training. So just to put it in perspective, a Band 6 is an equivalent level to some of the pharmacists as they come in. So as I say, if the pharmacist or university route isn't for you, there is a way to sort of progress up. So yeah, currently the lead for education and training. So if you want to skip to the next slide, please. A sort of day in the life is quite varied. So it can be things like medicines management, so looking at patients' medicines, dispensing and accuracy checking medications, holding team meetings, updating policies, procedures, patient counselling, and more recently my new role, careers fairs and events like this. So promoting what pharmacy does and coming in. But I would say it definitely is a career for life, and yeah, I love it. That's it from me.
Thank you very much for that, Kelly. So now I'm going to hand over to Jane, who will talk about her role in a pharmacy.
Hello, I'm Jane Myers. I'm 56. I qualified as a pharmacy technician in August last year. Next slide, please. As a kid, I always wanted to be a vet, but typically when I got to that crucial point, I managed to fail all of my O-levels, so then didn't know what to do. I loved being in the outdoors, which was probably why I'd failed my O-levels, because I spent more time outside than actually studying. I was lucky enough to enroll in college in Sheffield, which meant a 50-mile round trip every day to study outdoor and environmental education with 3 A-levels. That led me into being a qualified primary school teacher, which typically you burn out after a little while. So after 20 years of being a primary school teacher, I became a postie and I really loved it. Missed the kids, but you know, being outside all the time was great. And then I had a bit of a back accident and I really had to stop and think again. As a 40-year-old something, I still had nearly 20 years of a career to go. And that's where I started to come unstuck because I didn't know what to do. Careers advice was, you can do anything you want. You're a teacher. You've got all the skills you need, but no one actually tells you what roles you can fulfill. So for me, I started having a look around and saw a job in the Hull hospitals as in the pharmacy department to start a career again. I went to talk to them to find out what it was all about. They introduced me, told me that I could do a level 2, then I could become a technician, and filled my head full of all sorts of lovely things of aseptics, meds management, stock control, dispensing, whatever you wanted to do, you know, within the pharmacy role. It was huge. So I went and did that for 2.5 years, started the technician's course, and then a little job came along, which was a dream job of being a canine hydrotherapist. So I left to become a canine hydrotherapist, fully qualified, but sadly, 1, I couldn't quite get enough hours to make it pay, and 2, I had an existing back injury, which when you're hoiking around 45-kilogram dogs in and out of pools, doesn't really work for you. So sadly, I left. I was struggling then to get a job. You get to that age when people look at you and think, you know, you're a little bit over the hill, you're on the roller coaster going the other way. So when Aldi said no, I wasn't quite sure what to do. Ran into an ex-colleague from the hospital who said, we've got a job for a medicines optimization assistant in our GP surgery. And so I said, what do you do? And she says, well, you process prescriptions. And I said, do I sit at a desk all day? And she said, yes. And I went, no. Didn't want to sit at a desk all day. Applied for a couple more jobs, didn't get anywhere. Went back to my manager, Julie, and said, is that job still available? And figured I would work to live, you know, and not live to work. I was going to hate it, but it would pay what I needed, and it was a job. So I started 1 week into lockdown, which was lucky that I had a job, but it was also an eye-opener, because how do you start training 1 week into lockdown when you're supposed to keep your distance? And it's very difficult. I thought I would hate it. It was actually the opposite. I absolutely love it. Days fly by. You do something different every day. Every day you get shouted at by a patient, but you can usually help them and turn that around. And every day you make a difference to someone, and every day someone says thank you because you've helped them. It's such a varied job as an assistant, and it's hard, you know, it's hard to go through their entire role. I was the first person in our GP practice to go through the technician's course, and geographically we have practices in Scarborough, York and Hull, and again I was the first to go through of everybody. So that was an entertaining experience, because at the time they weren't recognising the GP practice as a pharmacy technician placement. So I did a placement in a community pharmacy, and also had to do most of my first year work around pharmacy, community pharmacy. However, it did mean that I got a good background in community pharmacy that I hadn't seen before, which was marvellous. Learned a lot about medications, and it also gave me the side that I wouldn't have seen otherwise as to where our prescriptions go when we finish with it, and the implications of what happens there. I qualified last summer. Next slide, please. And my day-to-day job is it's different every day. We have a background of, we process prescriptions, I reauthorize medications, the lower level ones. We also respond to GP queries. They might come in and say, I can't get hold of this patient. Can you give them this information, please? So you'll phone a patient, and hopefully you've got enough information about what you're supposed to be saying to them. Sometimes you don't. You have to get Dr. Google up to have a quick check, or better still, ask the pharmacist who's kicking around, because they actually really do know what we should be doing. We liaise with specialist secondary care services as well. Quite often we'll find a patient's discharged from hospital and we haven't received the paperwork that we need. So we'll chase the paperwork up, we'll get the paperwork in, we'll get it processed by a pharmacist so that the patient can get the medications. We'll also get queries from specialist services. For example, we've had several patients that have come to us with serious problems of obtaining medications. They've been issued by specialist services. They're unable to contact the specialist services, so they come to us and say, help, And again, that's our role. We help them out. We advocate for our patients, certainly our elderly patients. We'll phone them to help them get the medications. And sometimes we don't like to think they do, but things will also go wrong. And one of my roles is to investigate what's gone wrong, what's happened. If it's in-house, we do it as a significant event. If it's happened outside of our service, then it's a DATEX. And again, you're expected to look at the paperwork, fill it in, find out what went wrong. It is a no-blame approach because we want to know how we can stop it happening again, which is a great mantra for the NHS. Next slide, please. So I could spend all day going on about all the different things that I do, but for me, it's the excitement of what's happening next. Because there is so much pressure on the NHS services, and especially in the GP services, we as technicians have been asked to take on new roles. So I'm currently training to do hypertension clinics. So I will do face-to-face clinics with patients. I completed my phlebotomy. I just need to do a few more biometrics, which involves learning how, well, getting signed off on taking blood pressures. And then we'll follow up on patients who've started on hypertension medications. They'll come into the clinic, we'll take bloods, talk to them and counsel them about the medications that they've started on if they've got any queries. I could also do an MVQ4 if I want to, or follow the CPPE pathway to move on. I'm 56, so I'm not quite sure I quite want to do any more studying now. I think I've done quite a bit, but who knows? I've been asked if I want to be a vaccinator in the vaccination clinics, and every time I turn on the news, at least once a month, they come up with something else that they're going to ask us to do and cascade down. So what is next? I don't know, because it is so exciting with the way technicians can go at the moment. Whatever you start with doesn't necessarily mean where you're going to end up. And if you get bored of one role, like my previous colleague just said, there are so many other places you can go. Community pharmacy, into the hospitals, into prisons. The world's your oyster. Come join the pharmacy team.
Thank you, Jane. That's a very honest journey that you gave to us. So thank you for that.
So hi everybody, I'm Katie Tennyson. My official title for my current role is Community Pharmacy Clinical Lead for Humber and North Yorkshire Integrated Care Board. I've put together some slides, and it's probably a different way of showing the same information, so we won't dwell too long on it because I'm conscious of time. But just to highlight, as Kelly and others have done already, that the pharmacy team is more than just a pharmacist or a pharmacy technician. There's a whole wealth of different bodies doing different roles, and to try and capture that would be absolutely impossible. The second half of the list is just to capture where pharmacists are, and again, as Kelly's already touched upon, is wherever there's a medicine, a pharmacy professional will have dabbled or should have dabbled and swished their oar about. Pharmacists and pharmacy technicians and the wider pharmacy workforce are kind of like those healthcare scientists that always keep the patient in the forefront of their mind. It's that, so what's the important bits that I actually need to get across to patients? So you might be surprised to learn that, you know, there are pharmacy professionals in areas like regulation, as well as veterinary pharmacists, veterinary pharmacy technicians. Sports pharmacy is another big one. And I've put commissioning at the end because that is where I currently find myself. So next slide, please. That's just a few captured pictures of me from times gone by of when I like to refer to myself as a proper pharmacist that actually touched patients. Feel a bit of a fake one at the moment because being in the current role, it's not a patient-facing role. But while some may say it's a distant memory, I do still apply all that knowledge that I've gathered over many years every day. So next slide, please. My timeline's so stretched that it actually stretches over 2 slides, so apologies, but we'll speed through. It might surprise you. It's great to have so many people on the call telling you all about the pharmacy careers and having so many different varied paths to get to where they are today and where they will be tomorrow. My A-levels, you could say it was conventional. I don't know. I'll let you be the judge. I did my GCSEs locally. I did my A-levels. My A-levels are in maths, psychology, German and music technology. So if you'd have asked me back then, would I have had a career in the sciences, let alone be a pharmacist? I would have laughed and gone, no thanks. So all those years later, 20 years later, to find myself as a registered healthcare professional as a pharmacist is always a surprise to me. I do have a degree before my pharmacy degree, which is psychology. And at that time, when I started that degree, I actually started as a Saturday girl in my local Lloyd's pharmacy. So it's technically my pharmacist manager's fault from all those years ago that I stumbled into the world of pharmacy and thought, yes, let's get this a go. I did my MVQ level 2 during my degree at the same time. So I did my degree, I worked part-time, and I also did my MVQ level 2. I didn't have A-level chemistry from when I did my A-levels the first time round. So when I decided that I was going to do a pharmacy degree, I knew I had to go out and study A-level pharmacy. I don't like chemistry, so please don't ever think that you have to love chemistry and love the sciences to get what you do. I like the patient bit of it. I know what I need to know when it comes to chemistry. So there is room for everybody in the world of pharmacy about when it comes to you, whether you love your biology, your chemistry, your physics, and whether you're not so much of a fan. I started at the University of Huddersfield back in 2008. I was one of the members of the first year of pharmacy in that year, so there was no year above us. So we were truly the guinea pigs. We weren't even sure that we were going to come out with an M-Pharm, but thankfully we did. And after 4 years, I graduated and started my year's worth of pre-registration training, now called foundation placements, up in Pickering in a community pharmacy in North Yorkshire. Next slide, please. And that's when I registered with the General Pharmaceutical Council as well. Now, I was told that if you wanted to be anybody and do anything, if you wanted to be a true clinical pharmacist, that you couldn't do it in community pharmacy. That you had to do it in hospital, because this was pre the days of general practice. So I actually gave all my community pharmacy knowledge up and got a job as a newly qualified pharmacist in Hull. And I hated the 14 months that I spent there. It was not for me. I went back to where I did my pre-reg, back to community pharmacy, like putting on an old comfy pair of slippers. It was familiar. I liked the patients. I liked the interaction. And that's where I stayed. I funded my own clinical diploma. So you'll have heard Chloe talking about a clinical diploma. There are, it's available to any pharmacist, but I've, in some roles, in some job roles, they are funded. And in some roles, back when I did mine, there was no funding available. So I funded it myself. I completed that and also moved closer to home with my job, still in community pharmacy. Became a superintendent pharmacist. Now, a superintendent pharmacist is in charge of multiple community pharmacies and legally responsible for the running of those, safe and effective running of those for 365 days of the year. So you don't get a day off, even though you might think so. And I also, in my superintendent role, I actually worked for a company that had a number of different NHS services in its portfolio. At CHCP, which is City Healthcare Partnership, they support or deliver the running of community nursing, general practices. They had the prison healthcare at one point as well, had dental, the services. So again, wherever there was a medicine, I dabbled. And people will be, you might hear the term clinical governance bandied about, and Chloe and Daniel and Kelly have all talked about policies and procedures and guidelines, and that is predominantly what clinical governance is. I used all of that knowledge, and when my current job came up as community pharmacy clinical lead, I went for it, never even dreaming or contemplating that I would be the best candidate for the job, but here we are. What I do on a day-to-day basis, people might wonder, but my predominant, the primary purpose of my role is to integrate community pharmacy into the wider healthcare network that we find ourselves in. Now, the world of pharmacy is truly changing, and a lot of people have already mentioned that. It can become a bit of a cliche, but there is room for everybody, and it is changing. as Marianne's already touched upon, the pharmacists that come out in 25-26 will be independent prescribers at the point of qualification. And part of my role is trying to map out and understand how we can utilise those skills in a community pharmacy setting. General practice, secondary care, other settings already use pharmacists as independent prescribers. Community pharmacies just starting out on that path. So if any of you do decide to study pharmacy and become a pharmacist, you will have, by the time you come out of university, you will have an independent prescribing qualification. And by default, the wider pharmacy professional team, your pharmacy technicians and your support staff, they will all have changed in their roles and developed, because everybody will take on more roles as the sector in its entirety matures. So please don't be put off by thinking, oh, that's not for me, there's room for everybody. I'm going to pause there. I have got a couple of other slides, but conscious of time, we can flick through them, Tina, but if you want to flick on through to Paul's slides, and I'll hand over to Paul. Thank you.
All right, don't worry, we're nearly there. I'm the last one. Next slide, please. So this is me. I am a pharmacist. I'm also the CEO of a local pharmaceutical committee. So I'm at the different end of this career journey than most of the people you've heard so far. But I've also done bits of what most of them have done as well throughout my career. Next slide, please. Everybody's talked about their journey. Here's mine, and that's actually mapped. Starting out in a council estate in the East End of Glasgow, then up to the university years in Aberdeen, and then down into England, which I've never managed to quite escape just yet. My pre-reg down in Kidderminster, down in Worcestershire, and then various roles living and working from Chesterfield, Barnsley, Scarborough, and then washing ashore in Hull, as a great many people do, I'm told. But that's doing across all those different locations. Done lots of different roles, lots of different jobs, all within pharmacy. And the point of putting this up is to show that if you want to get out and move around and see a bit of the country and live other places, with pharmacy, you can. But equally, in the roles I've also done at area, regional, divisional and national roles, I've managed to do them all from Hull as well. So you can, with pharmacy, get out and about, but you can also just as much stay here and still have access to all of the different sectors and all the different arms that's available within pharmacy just from here. Next slide, please. So that's the whole CV sort of broken down from qualifying at the bottom all the way up to now. It pretty much breaks down to 3 distinct phases. You've got the dispensary bench phase, about the first 14 or so years, where I was a proper pharmacist. I never subscribed to that hospital thing. And I've spent a lot of time working in hospitals as well from the community side. But say that first 14 or so was that's dealing with people, developing services. No, back then we were one of the first ones to have an emergency contraceptive service here. As a community pharmacist, I was also working in GP practices over 20 years ago. And again, we were some of the first ones to actually let that happen. But after that, there was another 12, 13 years where it was the corporate years, where I was off doing the field roles and area management, regional, divisional, and working at head office for a very large multiple, named there, starts with B. So it started off as Moss, but got a bit schizophrenic for a couple of years, changed names a lot and ended up as Boots. But I did a lot of, I developed services in hospitals, outpatient dispensing. Same for prisons, all sorts of locations, mental health facilities, lots of different places and lots of different things, but all still very pharmacy related. And then the last 8 years or so, I sort of the representative phase where I'm out representing my contractors and representing the profession from various guises. So say I am a CEO for pharmaceutical committee and represent all the community pharmacies across the Humber. But I also, on side, I work for NHS Resolution, so I'm like an appeals court judge for contracts. When people apply to get contracts or do things with the contracts and they don't like what the result is, they then have to take it to appeal and we rule on them. So you get to hang out with QCs and retired judges and all that sort of stuff, which is interesting. They are an eccentric group. Next slide, please. And along the way, you kind of have to give back a little bit. This is sort of some of the various titles and external stuff I've been involved in over the years. You know, being the president of the local branch of the Pharmaceutical Society back when we had them, Pharmacy Development Group, all sorts of things. And this is sort of stuff that helps your professional development, but also helps your work experience and building your networks. Because although companies and organizations do business with each other, at the end of the day, people do business with people, and that business can be health. So even though I don't have a face-to-face with patients anymore, I enable others to actually have face-to-face health interactions by building services and working behind the scenes to keep them afloat. Next slide, please. Right, day in the life. There is nothing standard about it whatsoever. It changes every single day, is different. The only thing it has in common is the email inbox is always chiming away, ruling your life if you let it. Lots and lots of meetings now, far more than it used to be before COVID, because of course Teams means you can be in lots and lots of meetings, which is that's a skill set in itself, because you can go from totally drastically different topics within seconds, and you have to change gears very, very quickly. Whereas before, you used to be able to get in a car and drive for half an hour and sort of get your head sorted. Nowadays, it's click to click and you're in. But you can be doing everything. So say I represent all of the community pharmacy contractors. I run, in effect, a small business. I'm the CEO and company director of a small business. So I'm running a team. I have to keep accountants in line, budgets, all that sort of stuff, all the legal stuff, as well as representing. But so the picture you see there, that's me giving evidence to MPs at Westminster on the state of the pharmacy contract many moons ago. And you can go from that to just come back to the normal banal and signing off, you know, sickness and holiday requests, and a lot of being a shoulder to cry on for contractors who just need someone to cry on these days. So it's very, very varied, but it does touch into a lot of things and a lot of experience I've picked up over the years. Next slide, please. Now, pharmacy can take you into all the sectors you've just heard about this afternoon, all the different bits. We haven't really touched on industry, but you've got industry, you've got judicial, prisons, all this sort of stuff. You can do all of these within pharmacy. But just picking in some of the other skill sets that I've picked up over the years from all the different jobs. And these are things which you could also still do within pharmacy as well and still have job security. You know, all the marketing, IT, contracts, tenders, and all that, you see them. If you ever watch The Apprentice, which I watch for the comedy value, you see people pitching. I've done, you know, that I used to do that for real and for big money, you know, millions of pound deals and pitching and pulling tenders together and making sure all that's done for pharmacy. And this is the sort of the business side of the thing you can get into, and you can spin these off into alternate careers. If you want a banker profession that you're maybe not quite sure about, but you've got enough qualifications to get a profession behind you, and then you can work out what you want to do later. It's not just the other pharmacy sectors pure, but this is all the sort of stuff you can get into from pharmacy on your way, on your journey. Next slide, please. So just to sort of summarize and finish this whole thing off, so say obviously I'm at the end of the career looking back, more or less. There's still a few years in me, but still. and it's kind of, you sort of see what have you done. So we nearly had a School of Pharmacy in Hull. We were within 48 hours of actually having one. We had funding, we had support, but it took the global crash in 2008 to kill us. Personally, I put a pharmacy into a health centre in Nottingham entirely on my own, nobody else. And that was back in the day when tenders were that thick and had to be printed out in triplicate. But that had over £1 million a year turnover for many years. And again, the hospitals, Christie's Children's Cancer Hospital, Manchester, key man on that. The outpatient dispensaries that you have in Hull Royal and up at Queen's, I put them in there. That took a lot of years to get them landed. All sorts of stuff. But that's the corporate side of things. But what I have enjoyed is the mentoring and developing people. The pre-regs I've trained, I still see many of them around here and work with some of them as well. The chance to get involved in all sorts of stuff. So say, having far too much stuff to do with MPs at the moment. One of the problems of actually getting to know MPs is they remember where you are, and anytime anyone has a moan, you end up having to pick up the pieces, which is happening a lot at the moment. Dame Diana, thank you very much. But that's the sort of stuff that you can get into as well, because it is quite broad and bright and very broad reaching. One of the sayings that they have within the workforce board, within the local NHS, how they see things going forward is don't focus on the roles, focus on the skills. With portfolio working, they see people building up skills which are transferable, and that will let you flit about from all the different sectors. So at this stage, if you're thinking about pharmacy, think about what you might want in a career. But again, you don't need to nail yourself down. Pick up the skills that you like and you may need at some point in the future just to have handy. And that will be what will open up the doors to give you the options that you want. As I said before, if you actually want to use pharmacy to get away from here, you can do that. If you want to use it to stay here, you can definitely do that. You've got job security in any of the sectors you want to go into, and also you can reach out and actually have a national career and still have it from the Humber. So that's my career in a nutshell. Thank you.
Thank you very much, Paul. Thanks for joining us today. So have a quick look in the chat and see if we've got any questions. If anyone's got any other questions at the moment, if you want to raise your hand and ask the questions. There's people asking for a copy of the presentation that will be shared out afterwards, because I think they want to forward it on to their students, which is good. And just other comments, beneficial and very interesting listening to everyone's journey. Thank you so much to all our guest speakers for their time today and sharing their experiences with us. For more information about careers in health and care, you can visit our Careers Hub website.